So today I'm going to demonstrate how to do a subcutaneous injection. So first thing I'm going to do is look at my orders. It says that I'm ordered to give 18 units of U100 NPH and 14 units of U100 regular insulin. Subcutaneous now. Look at my medical records, looks good. So first thing I'm going to do is look at Pyxis. I'm going to go to anti-diabetic hormone. I'm going to go to NPH insulin. It says it's an E2. Go to E2. Grab a vial of that. Now I'm going to come and compare it to the Pyxis. Looks good. Looks good to medical records. Everything looks good there. Set that down. And then I need to also grab my regular insulin, which is an F1. So I'm going to compare that to the Pyxis. Compare that to the record. I'm just going to hold these up and make sure that I'm correct in everything. Looks good. Alright, so with NPH, you want to roll it. Because it's a cloudy solution, you want to make sure that the solute is continuous throughout. You don't want to shake it because that creates bubbles. So now that this has been rolling for about 10 seconds, it should be good to withdraw from. I'm also going to need a syringe. And I know that this is the correct syringe, has orange cap, is a U100 insulin syringe. So it looks good. Now with each vial, I'm going to scrub the hub for 10 seconds each. Each hub has been scrubbed for 10 seconds. I now can take my insulin syringe. Set the cap to the side. So with insulin, you're going to want to add the air to the NPH first. So I see that I've got 18 units for the NPH, so I'm going to want to get 18 units of air. And while I'm getting this insulin, I'm double checking everything with another nurse, as it is part of the high alert drugs within the PINCH acronym. So I've got 18 up here, so it looks good.
Good.
So I can remove that and go straight down without touching the sides. Can add the air. And now I want to withdraw 14. As that's what's ordered, 14 units of air from here.
Looks good.
All right. So I'm then going to go into my regular insulin. I'm going to withdraw 14 units of regular insulin. Make sure there's no air bubbles or anything like that. Okay, looks good to me. Again, I will check with my other nurse.
Good.
All right, and then I will add the remaining insulin to reach that 32 mark with NPH. Again, check with my nurse.
Looks good.
Okay. I can recap because it has not been in a patient yet. going to label my syringe with the amount of units, the patient, and all the information for me to identify the syringe. Once that's completed, I'm going to do my second check against my medical record, make sure everything's still correct. And it looks good. So now I'm ready to go into the patient's room. Hi, my name's Hillary. I'm your nurse today. First thing I would like to do is just check your name band really quick. So can I know your name and date of birth? Paul Brown, 5419XX, sounds good. Mr. Brown, do you have any allergies that you know of? Penicillin? Alright, sounds good. Alright. So now I'm just going to kind of go over some spots that we could potentially insert or inject this insulin. So you really want to pick a spot that has a good amount of subcutaneous tissue, and a good area for that would be the outer portion of the thigh. Mr. Brown does not have a ton of extra fat there, so we're not going to go there. Another portion would be the abdomen, but you want to ensure that there's a 1 inch or a margin around the belly button that we avoid. So you're going to be below the costal margin but above the iliac crest. That might be a good potential spot for a patient today. Another spot would be the outer portion of the arm, kind of like that back portion where we feel a lot more subcutaneous tissue. Another spot that kind of isn't commonly used is the scapula, kind of the backward portion of the shoulder. Not really going to use that one today either. And then a final spot that we like to use is the love handle kind of area, or kind of what we refer to it as. So it's kind of like the upper portion of the bottom, the lower portion of the back side. So that's another part that we usually like to go into. For our patient today, a good spot would be the abdomen, I believe. Two nursing diagnoses that we could use with his patient today is knowledge deficit. He might not know about his diagnosis, might not know how to do his calculations for insulin. Another one would be risk for hypoglycemia if he does not get the correct amounts. All right. So now that we have come here, I'm going to do my third check with my medical record. It looks right, like everything. It's the right medication, right amounts, right dose, and so forth. And I'm also just going to double check with my nurse again because I really want to ensure that this is the right amount. Does that look like 32 units of insulin?
Yes.
Perfect. Thank you. All right. All right, so I'm going to want to first clean the skin. I'm going to want to start in the center and do circular motions out. And once the skin is cleansed, I can take off the cap. And with this kind of injection, you're going to want to go at either a 45-degree angle if there's not too much subcutaneous tissue, but if there is more, you can go at a 90-degree angle. And I'd just like to note, before any of this is done, we would have checked his glucose level to make sure that we're within range and that everything is accurate, getting the right insulin. So I'm just going to kind of grab the skin. I mean, because it's his abdomen, he does have a lot more subcutaneous tissue. He's an older patient, has more of that kind of weight there. So we're going to kind of go in slowly, but not too slow, just right. And we're going to slowly administer this insulin. Once it's administered, we kind of just want to let it sit, make sure all the insulin goes in to our targeted area. Once that, we can straight up remove, put on the safety, put into the sharps container. I can take my gloves off, do some hand hygiene. And we're also going to need to document this. So I'm going to want to write the time, patient, make sure the amount, the route, where I inserted, so I decide to do the abdomen. So I'm going to describe the area that I put in, all that documenting information to ensure that is known what happened. And I really want to notice that my orders say that the recheck blood sugar is in 2 hours, so I really want to ensure that the time is there so we know when we need to recheck from when the insulin was administered. So once I have that all good to go, I can go over to the patient. Is there anything else I can get you today, Mr. Brown? No, not anything? All right. So I just want to say that your call light is here. If you need anything at all, if you're feeling a little off at all, just hit your call light and I'll be right here. Now that I've done that, I can return my medications to the Pyxis.